Hey, Dr. Ryan Hetland here. This is Nicole. She's our patient today. I wanted to show you how we adjust Nicole's upper back. Nicole, turn around here. So in the upper back, she has a spot in her upper back that's torqued like this, where her spine is out of position. So when we look at this here, turn around. This spine in your back should be straight, and at times we see frequently the spine is out of position like this and torqued in certain ways, and we can see that on x-ray. And I'll show you here on Nicole's x-rays. She's given us permission to show you these, by the way. Right, Nicole?
Fine.
Okay, here we go. So here's her spine here, and you can see how it's crooked right through this part of her spine. That pinches down on the nerves and causes her upper back pain at times, sometimes pretty severely, wouldn't you say?
Yep.
Yep. So I'm going to show you the table. I'm just going to move this. Sorry, this isn't Hollywood. We're just going to try and show you this table. Let's see, I'll move this down here for you. And how it specifically moves for her back. For her mid-back, where we're trying to adjust, this should move nice and easy to make it more comfortable in her upper back when we're doing the adjustment. And this is a really specialized design table, especially for people in pain who really can't get on or off a table really easily. It hurts them to use their muscles to get up and down. So we'll just have her stand on this. I have it set to her height, and then the weight of her body will just lower this down at a real nice pace that is comfortable for her. And so keep in mind the x-ray that I showed you and how that was on her spine, and I'm going to use my hand to specifically correct it in a way that you'll be able to see here. So what I'm doing here is I'm counting down on the vertebra, so that way I know exactly which vertebra that I'm on. Beautiful. How'd that feel, Nicole?
Beautiful.
Good? So what you were able to see there was that with hardly any effort at all, being very precise, in a very gentle way, she was able to get adjusted, and it helps her to be able to not have any back pain in her upper back, help control the pain that she feels, whereas without an adjustment, what do people usually do? They just take pain pills, try whatever they try to do, but there's nothing that can make up for correcting a spinal misalignment that's in there. If you're suffering with any upper back pain or neck pain and you haven't seen a chiropractor, I'd recommend you take us up if you're in the Twin Cities area and check us out and give us a call. So hope this helps you. Feel free to comment and message me and reach out. Have a great day. See you back here next video.